Do you have pain around the kneecap when running, climbing stairs, or after prolonged sitting? You may be dealing with runner's knee, or also known as patellofemoral pain syndrome. I am Dr. Sebastian.
And I'm Floyd. I'm the PA working here at Integrative Rehab Medicine.
So today we're going to talk about runner's knee. We're going to talk about what it is, what are the symptoms, how to diagnose it, and best of all, how to treat it. So what is runner's knee?
So runner's knee is where people are having pain, also called patellofemoral pain syndrome. So you have your kneecap, your patella, and then you have your femur bone. And that patella is supposed to glide inside here, up and down. And so when people have either muscular imbalances or sometimes specific injuries or laxity of the ligaments that hold the kneecap in place, that can become inflamed, and eventually it'll lead to degeneration of that cartilage, which is that smooth outer gliding surface that allows those two bones to go back and forth.
So basically, this kneecap, this low bone, should be gliding up and down inside this low groove. And when it's not gliding properly, or if there's some inflammation, that causes runner's knee or patellofemoral pain syndrome. So what are some of the symptoms of runner's knee?
So people are going to have pain, they're going to have swelling, sometimes they'll actually feel or hear clicking and grinding, especially when they're getting up from a seated position. Those are going to be the most common symptoms that people are going to have.
So how do we best diagnose runner's knee?
We're going to be using a physical exam, so you can actually press on the kneecap and see if that reproduces the patient's pain. We're going to do a specific type of x-ray. It's called a sunrise view, so you can actually look straight down from the top and you can see how that patella is sitting in the groove. And then if we need to, we can get an MRI, and that'll actually show if there's cartilage breakdown or if there's some more damage on the bone itself.
So when you do have runner's knee and it's been properly diagnosed, there's lots of treatments that are available. The standard of care treatments are taking anti-inflammatory medications, which we know have a lot of side effects. Things like ibuprofen can affect your kidneys and stomach, but a lot of people do use them for runner's knee. You can also get a steroid injection in the knee, which we typically don't recommend because steroids can actually break down the cartilage. Physical therapy is a good place to start, but sometimes it's not adequate. So when physical therapy is not adequate, we usually, in our clinic, use regenerative medicine. Things like prolotherapy, PRP, or even stem cells. So let's talk about what are these regenerative medicine treatments?
So prolotherapy are going to be injections with dextrose. So prolotherapy can work really well when people are dealing with ligament laxity and very mild arthritis. A lot of people have laxity of the ligaments that actually hold the kneecap in place. So we can go around and we can inject into those specific structures and tighten them up. When people have more significant degeneration, we're going to be using PRP. PRP is platelet-rich plasma. So we take your blood, and we have a lab here in our office. We process the blood, and then that's what we use for the injections, and that's full of growth factors and other things that can work for more significant degenerative changes. When people have really severe degenerative changes and we're having breakdown of the cartilage, or more specifically, if there's bone marrow edema, swelling in the bone itself, we can use stem cells and inject that. And sometimes we can even inject it directly into the bone, right where those inflammatory changes are, to get the best effects.
So the best way to inject these biologics like stem cells or PRP or even prolotherapy is to do that under ultrasound guidance. So in our clinic, we use an ultrasound probe, we put it on the knee and around the ligaments, and that allows us to see exactly where the needle is going and exactly where the injection is going. And that really provides with the best results. The other thing, making sure that the PRP is very high quality. In our clinic, we have a lab where we can concentrate the platelets to a very high concentration, and that can give us very strong results. So between the prolotherapy, PRP, or stem cells and physical therapy, a lot of people can get rid of their runner's knee or patellofemoral pain syndrome for good without surgery or steroid injections. So if you are interested in healing your knee and getting rid of your patellofemoral pain syndrome, click the link below, visit our website, and give our clinic a call.